Good morning. All right, great to be here. I've had the pleasure of being the chair of medicine at Singularity University since it started. And in this session, we'll be crossing how technology is impacting the future of health and medicine, yours personally, your friends and family, and how technologies and maybe your companies and countries can help collaborate to reinvent the future of health and medicine. We'll have a conversation with Dr. Dean Ornish, a leading figure in healthcare, and from Stefan Bancel, leading a major, very exciting exponential new pharmaceutical company. So let's take a dive now in this 30 minutes into the future of health and medicine and how technology can help us reshape and rethink its possibilities. And of course, healthcare is a big continuum from your personal health and wellness to how you do prevention, to how we can think about diagnostic and picking up diseases early, all the way to the future of personalized and more precise therapies, even the future of discovery and global health. So in this talk, I'm going to try and cover all of those quickly and give you a taste of what's here today and where the puck is heading. But sometimes, when we look in the future or look at today, it sometimes feels like we're back in the future. And I had that experience myself. I went to medical school down the street at Stanford and then did my training in Boston at Massachusetts General Hospital. I was back there recently for the 200th anniversary of MGH. We had a reunion of the house staff. Those were us back in the day. Almost 20 years ago, I was an intern. And during the reunion, I visited one of the most famous spots of healthcare history. It's called the Ether Dome, because back over 160 years ago in 1846, the very first general anesthesia was done there. Imagine having surgery without any pain meds. In 1846, at Mass General, the first discovery of how to do that was achieved in the Ether Dome. So if you visit the Ether Dome, it's pretty much a shrine to medical history, frozen in time. And you can actually see the sponge of the instruments from that first case. Hasn't changed in over 160 years in that room. I then wandered down the hall that night, about a 4-minute walk away, to the ward where I spent my first month as a brand new, terrified young doctor. And to my shock and dismay, that also was frozen in time. It hadn't changed in 20 years. Some of the same alarms were beeping, maybe some of the same nurses, some of the same patients. The poor intern on call was having to push around a laptop, typing out a medical record, printing it out. And the front desk there was still using our cutting-edge medical communication tool, the fax machine. So my thought was, even at a great academic institution like Mass General or Stanford or other places, we're in some cases still practicing healthcare like we have for hundreds of years in old silos and old ways of thinking. Maybe some of your companies and endeavors are still based in old silos and ways of thinking. And in this new digital age, this exponential age, this connected age, we can rethink and reimagine healthcare outside of the bucket of body parts and subspecialties in a new way and move us from kind of our sick care era to an era of true healthcare. And when I say sick care, what do I mean? Think about how you do health and medicine today. You might get intermittent data, an occasional blood pressure, EKG. You might be faxing your data to your doctor. So the data is intermittent and episodic, and therefore we're quite reactive. We wait for the heart attack or the stroke or the lump to be discovered at an advanced stage. And I think with this new convergence of technology and thinking, we can move to a new, more continuous era where we're much more proactive individually and as a society around our health and medicine, and get out of our sort of mindset of going to the doctor's office, waiting for an hour for that 12-minute doctor visit where you're here in San Francisco or in Mumbai or anywhere on the planet. Major opportunities to shift the way we do medicine. Now, of course, technology, which we're going to focus on today, is important, but actually more important is how are the incentives? How do we pay for healthcare? Because that drives almost everything. Here in the United States, we're mostly fee-for-service. We pay doctors and hospitals to do more procedures and more biopsies and to treat patients, not necessarily to do prevention. As we'll hear from my friend, Dr. Dean Ornish, we don't practice evidence-based medicine, we practice reimbursement-based medicine. And I think we're going to start to see now in this era of value-based care, we're going to start rewarding patients, doctors, healthcare systems to prevent disease or to treat it smarter. You'll only pay for the drug or device when it works. Another major shift is, where does healthcare happen? No longer just in the intensive care unit, the emergency room, the clinic. Increasingly, we're bringing healthcare outside of the four walls of the clinic, the hospital, to our homes and onto our bodies. The Internet of Things is coming to the Internet of Healthcare. It's coming to your local pharmacy. They're all battling to become your primary care hub. On top of these incentives is now you, the empowered consumer, can compare one hospital to another, the prices from one pharmacy across the street to another. You can go on iodine.com, like a Yelp for drugs, and see how drugs are working for other patients like you. So now the empowered individual can compare and contrast. And we have, of course, a whole new set of exponential tools at our disposal. Our smartphones, of course, the exponential technology of our age, are really becoming key healthcare platforms. Of course, everyone wants to know what the next iPhone is going to look like, so I have a sneak peek at the iPhone 10, and here's the iPhone 11. So clearly important parts of healthcare. Now, as we move forward in this paradigm, we're even seeing smartphones become modularized. Google's working on the Aura phone. Imagine having different components that can track your blood sugar or your cardiac. So really interesting exponentials coming together. And of course, the theme of Singularity University in the summit is understanding exponential growth. It's where disruption happens, and it's particularly opportune to bring that disruption to healthcare. You know, the desktop of 2000 fits on your smartphone, now fits on your smartwatch. It's now fitting on a computer the size of a grain of rice. And again, the connected Internet of Things can come to Internet of Medicine, to the Internet of Health. And often this is now called connected health or mobile health or digital health. It's a bit of a buzzword, they're all buzzwords, but the idea now that we can start to connect the dots and start to make sense of massive amounts of data can give us new ways to converge and reinvent healthcare. Now, a big theme here also is convergence. It's not just Moore's Law and IT, but bringing together virtual reality, mobile, big data, 3D printing, nanotech together gives us the opportunity to address these grand challenges we have across healthcare. The rising costs, aging demographics in most Western countries, big data, lots of data coming at us, but how do we make that useful and actionable to you as an individual? How do we unfragment care between paper records and electronic ones? And even though a lot of technology is already here, there's a big challenge in getting that to the clinic. Our friends at the FDA, the F word, have challenges thinking exponentially. And our friends, the payers, the insurance companies, also have trouble rewarding and paying for some of these new devices, apps, and platforms. So we're here in Silicon Valley, the home of innovation and reimagination. Of course, we all talked about Uber and how that's disrupting travel. Uber themselves are going to disrupt themselves with self-driving Ubers. I was behind one of these Google self-driving cars in Mountain View last week. I was very excited to be behind it until I saw that it was driving exactly the speed limit. It was very frustrating. But people like to say, who's going to build the Uber of healthcare? We all want that kind of on-demand accessibility. Uber themselves has now piloted Uber Health. You press a button on the app, and a nurse comes to give you a flu shot. There's now at least 5 or 6 companies building house calls for doctors. Press a button on the app, and a doctor comes to you. And you can rate them, and they can rate you, because I'm not sure what kind of doctor you're going to get. So this idea now of healthcare on demand is starting to emerge, or delivering your drugs in this realm. So disruption's coming. It's coming to our friends in the pharma world. How are they going to meld into this new era of personal genomics? It's coming to our friends in the payer world. How do you reinvent the insurance model? All these things are coming quickly. And it's our opportunity to be the disruptor, not the disruptee. Now, as I mentioned, I've had the real distinct privilege for heading up the healthcare and medicine side of Singularity University. And what's really interesting, particularly in our 10-week summer programs, is that about half of the new team projects are moving into focusing on addressing challenges in global health and healthcare in general. And because so many people are interested in health and medicine, personally or otherwise, 5 years ago, I started a program at our home base called Exponential Medicine. We started with about 100 folks, and we've now grown that more than exponentially to about 500 folks. We now meet every fall at the beautiful Hotel Del Coronado in San Diego. It's called Exponential Medicine. I hope some of you or your friends and colleagues can join us. It's October 8th or 11th. Lots of talks and resources are exponentialmedicine.com. And of course, this year, last year, we took a picture by drone. You know, a $50 drone now can take a picture of the whole crowd. So come join us for that in the fall. All right, let's look at a few areas specifically and how you might use them today in your own health and prevention. First of all, genomics is very important. We'll talk more about genetics and genomics later, but it's your behaviors, especially your behaviors over time, that are much more impactful to your long-term health. Poor diet, stress, exercise, sleep. Bad versions of those behaviors lead to most of our chronic conditions and most of our big costs. But now we're in an era where we can start to measure and record these. How many are wearing a Fitbit or something like that? I'm wearing 4 different versions. How many have had one and lost the battery and it's in your drawer? Yeah, it's the other half of the room, right? Well, we're in the early age of what's often called quantified self. You can track your steps, you can track your sleep, you can share that on social media. But what's exciting is that this world's moving very quickly. You know, 13 years ago, I did a project with NASA. We went to Chile. We were this black box for the body. Those now have shrunk to what we can wear on our wrist. We can now quantify much more than our sleep and our steps. We can quantify almost anything. The trick is, what do we do with this data? And I think where we're moving is from this era of quantified self, knowing the data yourself, to quantified health, where this data is going to start to integrate with your own doctor, your own healthcare system, where you can donate this data, you can gain insights from it. In the United Kingdom, we're seeing the National Health Service there start to prescribe devices and use that data to flow into the medical records. We're going to see this being used for managing chronic diseases like heart disease and emphysema. And what this means for you is that, as Peter Diamandis likes to say, you can now be the CEO of your own health, or at least the COO. You can understand your data. You can include yourself in trials. You can donate your data. And the sensors are moving well beyond their simple step trackers. Sensors that can go in pills that you can swallow. Sensors that can be glucometers and talk to your smartwatch. Digital tattoos are being developed. E-skin that can give you data about your blood sugar or your oxygenation. You can have sensors in your swim helmet to track your swimming, or in your tennis serve to help your sports activities, or your kids who are playing soccer or rugby to see how their heads are doing if they're at risk for concussions. We can quantify very surprising things. For example, older patients, we can track their gait with sensors in their shoes. And we're moving well beyond wearables to the idea of insightable. Google, of all people, their new company Verily, is developing contact lenses with Big Pharma and Novartis that can track blood sugar. So the idea of insightable, even chips that people are starting to keep underneath their skin that can record things in real time. So there's several very interesting ways we're going to see technologies inside our body measure us in real time and transmit that back to ourselves and our healthcare teams. How about trainables? What if you could get insights into our postures in our smartphone era? We're always, stuck on our phones and our laptops. What if you could have a little digital nudge? This is a technology out of Israel called Upright. You can buy today, a little sticker on your back. And you can take the sticker on your back, and when your posture is poor, it'll give you a little buzz. And after about a week of wearing that, will help you regain proper posture. So you can train up your posture. Or maybe you need a little shock to keep you going, shockables. Hearables, we now have wonderful Bluetooth devices that we can put in our ears that can track our music, but the new versions actually can track our steps and our heart rate. Breathables, devices now that can look at our breath, which might be important if you're going on a date or tracking your blood alcohol level, but now can actually maybe detect diseases like lung cancer. So we can quantify all sorts of things. Wearable rings that can track your sleep, sweatables that will look at your sweat if you're exercising or have diseases like renal failure. What we really want is not multiple devices, but to integrate these so they're simplified and not technically challenging. You don't need to recharge them. And we're moving to an era now where even big companies like Apple, Samsung, Google are coming into healthcare. Tim Cook confirmed that Apple's really focused on health. An apple a day keeps the doctor away. Might mean something new in the near future. And the incentives are changing to keep you walking and moving, which means everyone's going to start hacking the system in other ways as well. Okay, so we can start to quantify our clothes, our environments. It's great for sports, but we can even track our youngest patients, even in utero. Once they're born, you might want to track other behaviors and elements. Connected diapers used to be fiction, but Huggies came out with Tweet P. It's real. There's versions for number 2 as well. Lots of data. I'm a pediatrician. It might be very useful to send a child home with a sensor in their teddy bear or in their onesie to track how they're doing and maybe keep them safe if they're at risk for certain diseases. So we can track all this sorts of information. The challenge is, so what? What do I do as a doctor, as a pediatrician, to make sense of this? How do you as a parent not get overwhelmed by this data? We need to start integrating and simplifying it. One other interesting area is mental health. Mental health, while other diseases have gone down, things like suicide have gone up or stayed stable. We can now see that our smartphones can track our emotional status, what our facial expression is. You'll see a company outside called Beyond Verbal in our demo room. They can look at your emotional status. Salim mentioned this earlier in his opening talk. You can look at someone's voice and analyze what they're really thinking. Now that can analyze how happy or sad or depressed someone might be. So we're starting to see this integration of tracking multiple elements from our steps, our sleep, our social network activity. You can even, through the camera on your phone, pick up heart rate and stress levels. Or is someone lying based on how warm their nose might be? So imagine the future of political debates when we get real-time lie detectors. Might be interesting. So mental health, we're seeing apps like Ginger.io start to integrate this information and have biomarkers for your mental health. So really interesting opportunities in that space to give you virtual hugs or call on your care team. Our smart homes, our connected homes, Wi-Fi alone can start to pick up the vital signs of up to 10 people in the same room. So without wearing anything, our digital exhaust is going to be collected. So we're in a sense, going to be online all the time with our health exhaust. And that's going to give us interesting challenges and opportunities. Again, it's a bit of a so what. No one wants to log into 10 wearables and 10 apps. The data needs to flow, ideally to you and to your healthcare team in useful, integrated ways. And we'll be using machine learning and AI to make sense of that. And just in the last year, this is starting to happen. If you have HealthKit on your smartphone, or Samsung has a version, or Google, you can now integrate the data from multiple devices, your scale, your blood pressure cuff, your steps, and even start to send that to your own healthcare team. Google's building a similar version. So lots of opportunities now to connect the dots. And maybe again, just like we have FICO scores for our financial health, have a FICO score for your health overall and use that as a measure to do prevention and improvement. Sleep, something so important, many of us aren't getting it this week. I have a sensor at home that can measure a good night's sleep from multiple factors, or not such a good night, right? And what happens if my resting heart rate is going from 59 to 70 or 80? Maybe something's going on. What if I could use that data to look at my trends? I call it predictalytics, to predict where's your healthcare taking you. I think that's the future of all these devices, is to provide actually more of a check engine light for your body, integrating, like your car does, multiple sensors to give you early warning, kind of like an OnStar system for your body to integrate and be a GPS for health. Daniel, take a right and go to the gym, not left to the fast food restaurant, or to manage a disease. So with all this information, we have lots of opportunity, but we know behavior change is hard. So we're starting to see the evolution of digital coaching, coaches you can talk to through your smart devices, or AI coaches like Lark, which you can download today and can track your sleep and your steps and your diet and can remind you to get a good night's sleep. They're sort of chatbots for health, or versions that can look at your questions and answer and
Hello,
send you to a
my
doctor
name
if you
is
need
Molly.
one.
I am your virtual medical assistant.
Virtual medical assistants are coming, or home robotics are going to help you track your medications. I'm sure some of you might have an Amazon Echo, kind of fun to pull up music or the news, but imagine using that to help track your blood sugar or remind you of what a healthy meal might be, or if you fall, to call for help. Your coach might be in your virtual mirror. In the morning, you wake up and look at yourself in the mirror. It may give you data about yourself that might be useful. And imagine when you look in the mirror, you don't just see yourself, you see future you. You just saw an earlier talk about having a personal avatar. Well, your avatar, if you're getting healthy, if you're doing your workouts, you're really working out, or what if you keep having donuts for breakfast, future you? You saw a great example of that. Me now, me 1,000 donuts later. That might change your behaviors, right? Or if you or your children might be smoking, what is your skin going to look like? This blending now of augmented reality can give us tremendous opportunity to shift our perceptions. Or if you spend too much time on Facebook, another issue. So augmented reality is coming. Obviously, Google Glass almost seems antique today, but it's playing amazing roles in operating rooms, giving doctors insights in data. The HoloLens is here and is being used not just for doing gaming, but for medical students to learn anatomy in collaborative ways. We're seeing other versions come out that are going to replace our computer screens and enable us to interact with data. So the augmented reality world definitely has touch points in health and many other fields as well. You're going to see surgeons using this to overlay data from an MRI scan or CT scan to help them do, for example, a spine surgery and to see exactly where they need to operate. So again, the blending and convergence of these technologies is coming fast and furious and going to really opportunize and improve things. Virtual reality, the expensive version, the low, cheap cost version for the Google Cardboard. This has even enabled surgeons to save children's lives by looking at the data and figuring out how to do an intervention. Or recording surgeries in VR and letting people watch them. Actually, I was in London 4 months ago, the first live stream surgery. Over 4,000 people were watching the surgery in real time around the world. So new ways of doing medical education or doing smart exercise so you can stay on top of it. Pokemon Go, I'm level 8, is a great way to get people out of the house, both for their physical health and their mental health. Now let's look at genomics, for example. The price of sequencing your own genome is dropping at twice the rate of Moore's law, from millions of dollars to about $1,000 today. And the challenge is, what do you do with this data? You can get a 23andMe kit. You can get lots of information there. For example, here's my data, my risk of certain diseases, how I respond to certain drugs. The trick is to get that to your doctor as part of their workflow and to you in ways that's useful and empowering. I just had my $1,000 genome, full genome done. Again, that needs to start to plug into our healthcare systems and make it useful. We're starting to see app stores for your genome being developed where you can upload your data. For example, this is my data related to my athletic performance for my genes. Sure enough, I'm a fast sprinter. My metabolic efficiency is high. I'm not a great long distance person, true enough, my endurance is 34%, whatever that means, and I want to get out of bed and do my workouts, but I have trouble in the morning. I have an excuse. My motivation genes are low. So, that's pretty complex data made useful. Beyond the genome, there's the proteome, there's the microbiome. We're learning that the bugs in our GI system play a role in all sorts of diseases. And it can even be used to do fecal transplants to cure certain diseases, like bad infections of the gut. You today can get your own microbiome sequenced and learn how that might play a role in disease. We're learning that the bacteria in your gut may play a role in everything from anxiety to obesity to other psychiatric disorders, and a whole new types of companies are starting to build microbiome-based therapies. Now, of course, all this technology is great, but there's old school technologies that are wonderful. Some of you might have done meditation today with Swami in the morning. Anyone do meditation this morning with Swami? He'll be doing it tomorrow. Swami Ananda like to say, the only medication you need is meditation, right? Ancient technologies can be applied in smart ways, how they affect our brains. We can now look in real time with wearable brain-computer interfaces, how our brains are doing, use those to help us speed up our ability to do mindfulness training or meditation. Or we can use these headsets to train kids who have attention deficit disorder to focus. So new ways of interacting with our brains. We're seeing forms of this apply energy to our brains, which might make us at least briefly smarter. So lots of new technologies coming to our brains. On the advanced side, we can even enable quadriplegics to use brain-computer interfaces to control robotic limbs. Tremendous opportunities there. We can, on the more simple side, use video games, something that you might not think of as a benefit, to train our brains and even do cognitive enhancements. So down the street at UCSF, they've shown with brain-computer interfaces in a simple game, you could dramatically improve your ability to multitask. And now they add this with video gaming and movement to help rewire your brain faster. Okay, let's look at the future briefly of diagnostics. We want to pick up disease early rather than late. Take again in the brain area, Alzheimer's. What if you could use blood-based tests or brain scans or biomarkers or eye tracking to pick up Alzheimer's 10 years before it shows up? Then maybe some of the new drugs in development that can stop and reverse plaques you could take before you even have symptoms, like we take a statin to help heart disease. We're seeing digital pathology emerge. So you can digitize pathology, and now computers are doing a better job of pathologists of making diagnostics and making the diagnosis itself. So we're going to see AI pathologists, AI radiologists. Doctors like myself now have a digital doctor's bag. You can attach almost anything on your smartphone for doing an ear exam, for example, if you're sending your child home with an ear infection, or to do skin exams, a simple analysis with your smartphone, take a picture, send it to a real dermatologist, or send it to the AI dermatologist. We have digital stethoscopes. This little attachment digitizes an old analog stethoscope, and it can digitize the heart sounds. But we're going to be throwing these away now soon because there are $2,000 ultrasounds that connect to your smartphone. And it will give us tremendous opportunity to diagnose almost anything on the fly. So many of these tools that used to require a hospital or clinic can fit in your pocket and can give us, particularly later with AI and analytics, new ways to say, is that a melanoma or a mole, blending AI and diagnostics. The old eye exam, the new eye exam can be in your smartphone, not just for the front of the eye, but the back of the eye. Or take something common like a cardiac disease. A little sensor on the back of your phone can pick up your EKG. A new version is going to do that on your watch. So we can hand this around the room and screen everybody for heart disease. And let's say you do have heart disease. Maybe we can do something about that. We can send you to wear a patch. For example, I have a patch I'm wearing right now that's streaming my live vital signs anywhere in the world, my full EKG, my temperature, my steps, my posture. And if we picked up a problem, instead of giving you a cardiac catheterization, we could do a virtual angiogram where you would go and have a CT scan. We'd send that data to the cloud as opposed to the old-fashioned way, and we could computationally analyze how narrow is your blood vessel, and could we now give you a stent? What kind of stent? Maybe we'll 3D print the stent to match your exact anatomy. So again, non-invasive diagnostics replacing old school versions may be quite disruptive to our friends in the cardiology world. Or MRIs that can be reconstructed to look at your heart functions and replace echocardiograms, for example. Lots of things are coming in this blend of convergence. Now, there's new prizes and incentives for innovating. We'll hear more soon about the X Prize. I've been involved with the X Prize in designing a medical tricorder X Prize. Over 200 teams entered the competition. We're in the finals right now to build a medical diagnostic tricorder inspired by Star Trek. One of the companies started at our first future medicine program called Scanadu. This little device, which is in clinical trials now, can touch your forehead, pull down your temperature, your heart rate, calculate your blood pressure, and give you understanding at home to collect this data and analyze it with AI and beyond. They've also developed ways to dip your urine and do analysis. So this is going to bring us to a world where at home, you as a consumer can have a whole set of tools that used to have to go to the emergency room and to utilize. So diagnostics is coming, home-based blood tests, all these things will emerge and give us lower price detection. Some of these tests we can print out, like an Ebola test or maybe a Zika virus test. Some of these tests are being developed on paper, so we can bring them anywhere in the world. We can now use blood-based tests to maybe diagnose and detect cancer early. Blood biopsies are coming. All these things are moving quickly and changing the way we'll pick up disease early. The challenge then, of course, is this is lots of data. You know, patients will come to me with a stack of Google stacks. How do I get smarter about this? This is too much information for anybody to make sense of. So we're starting to see the era of AI, or I like to call IA, intelligence augmentation, really help the doctor, help the patient make sense of all this information from our connected wearables, our Apple data, our J&J. Watson is starting to connect to all these. We'll see this sort of example impact all parts of healthcare, and ideally, again, help you to intervene early rather than late. So a whole system of systems medicine coming together. None of this technology, however, replaces the important patient-doctor relationship. Some things computers and robotics can do great, but I still want to emphasize that we need that human touch to be integrated in all this as well. How about the future of therapy? We want more personalized therapies, whether they're pills we can swallow that replace endoscopies to screen for colon cancer, or little micro robots that are going to start moving through our GI system, for example. We're seeing gene therapy move quickly. The whole area of CRISPR, which you may have heard about, is going to enable us to fix diseases by replacing the bad gene with a good gene and cure things like sickle cell disease and thalassemia, maybe HIV. This is coming to clinic this year. Well, we may even start to edit children prenatally. We can start to sense our pills when you swallow them. Companies like Proteus can have an RFID on the pill. We're seeing pacemakers go well beyond the heart. Pacemakers for your brain, for your gut, for your bowel. Pacemakers and implants that can be remote-controlled contraceptives. What happens, however, when someone hacks your contraceptive device or your pacemaker? Those are challenges there with data privacy and who controls and owns this information. We're starting to prescribe apps as therapies, apps that can be used for pre-op care or to keep patients safe outside the hospital and prevent them from being readmitted. We're seeing apps that can be prescribed and are FDA approved to manage diabetes patients, and now increasingly complex glucometers, even with social networks built into them. So tremendous opportunities now to blend data, mobile, diagnostics, and therapy, and even patients and their families are starting to hack devices together. Sort of the hacking health movement is here. So what does this mean? We're now entering an era of virtual visits. You can download an app, talk to a doctor, not usually your doctor, but you can start to interact through telemedicine. We're seeing ways that these telemedicine apps can start to monitor you, not just your voice and your face, but your facial expressions. You can have chatbots through Facebook today that can start to answer basic questions and help do telemedicine visits. So I think telehealth and telemedicine is going to really be a game changer in how we access care and give us additional touch points as we go. So last year, 2015, you can't list your iPhone as your doctor. 2016, I can't be your doctor if you won't download my iPhone app. Things are changing. Robotics, all these things are coming to the clinic. I'm sort of running out of time just to mention that robotics can be worn for exoskeletons for those who can't walk. Some of those are 3D printed. 3D printing is something that's coming clearly to healthcare in interesting ways, from building prosthetics that match an individual patient, to replacing casts, to being able to print versions that match kids on the beach, or ones that might match your individual hip for your hip implant. All these things will be disruptive. You've heard about Made in Space. They sent the first 3D print of the space station. Maybe you need to print a medical device there emergently, and you can have one when you need it. Or print a prosthetic that matches you. Someone has cancer, you can make a prosthetic that matches their exact face if they need one. Or even starting to 3D print drugs, or 3D print parts of organs, which today can be used to do drug screening or make organs on a chip, but are going to quickly move to clinical trials and implanted organs as well. 4D printing is actually another area as well. All right, last 2 points. Global health. We can use these technologies to democratize healthcare, to bring the poorest on the planet who have SMS phones and still have smartphones, connected data. Project Loon, beaming connectivity. Everybody on the planet will soon have an AI doctor on their phone and can order and bring drugs and devices to them by companies like Matternet, which is one of our SU GSP companies, or defibrillator, or maybe an organ will be delivered in these WAMs. Lots of opportunities there. Of course, this requires smart design thinking. Lessons from aviation, from checklists and simulation are helping train doctors and nurses. Simulation for everything, and I mean everything can be done today. So medical education needs to shift. We'll have new incentives and ways to track patients in our data. And what this all brings us is to an era of discovery. We can all reinvent clinical trials. You can donate your genetic data, your microbiome data. You can download clinical trials on Apple Today, Research Kit, trials for autism, for Alzheimer's, for asthma. You can be part of these trials today. So we're gonna start crowdsourcing. Just like we crowdsource our maps when we drive, with Google Maps, you donate your data, but you get a map of the traffic back, and that's being data donors. That same sensibility can come from healthcare. We can crowdsource health. We can all not just be organ donors or blood donors, but data donors as well. And some interesting things we can learn from our shared data, maybe who to shake hands with or not shake hands with that day, is all in that sort of crowdsourced information. So as you look into the future, whether you're in healthcare or not, think about convergence. Think about all these exponential technologies coming together, and to realize that we're here in 2016, we're here now, but the puck is moving quickly. You need to skate to where the puck is going to be. And if we use that exponential and convergent thinking, we can really reimagine healthcare, from sick care to healthcare, from episodic and reactive and siloed to continuous and proactive and participatory. And realize that we can take exponential steps. Just like some of these technologies in my pocket, the technology is already here, it's just not evenly distributed. And it's up to all of us not to just predict the future, but go out there and create it together. So with that, go exponential. Thanks very much.